Hi, I'm Lily. Thank you for taking the time to learn about Medicare's Care Management Program. The Centers for Medicare and Medicaid Services acknowledges that chronic care management, CCM, is an indispensable aspect of patient care that leads to improved patient outcomes. In 2015, Medicare began to provide reimbursement to providers under the Medicare Physician Fee Schedule for CCM services delivered to patients with multiple chronic conditions. In 2021, CMS added billable principal care management CPT codes to meet the needs of patients with one chronic condition. CCM is a group of extensive evidence-based care management and care coordination services that, when implemented correctly, improve patient outcomes and are billable by physicians and non-physician practitioners. Examples of non-physician practitioners, as defined by CMS, are nurse practitioners, physician assistants, clinical nurse specialists, and certified nurse midwives. Preliminary provider qualifications for billable chronic care management services include the following. The provider must be a physician or non-physician provider with a certified EHR, provide patients with 24/7 access to the provider practice, and have completed an annual wellness visit on the patient in the last 12 months for CCM, and in the last 3 months for PCM. The provider of CCM and PCM services should have Medicare-approved assessments, documentation, and care coordination protocols to ensure improved outcomes and reimbursement. The greatest mistake that most providers make is assuming they can assign CCM or PCM program management and tasks to a member of their team and expect good results. Operating a CCM or PCM program requires specialized knowledge, skills, and persistence. We'll talk about that more shortly. Now let's talk about the Centers for Medicare and Medicaid CCM qualifications for patients. In order for a patient to qualify for CCM or PCM services, the patient must be a Medicare beneficiary, have one or more chronic conditions, and the patient must provide Medicare-approved consent to participate in the program. The patient's consent must be documented according to Medicare guidelines. Billing is a critical part of your care management program. According to the current physician fee schedule, there are 4 CPT or billing codes you may use when your team is providing CCM or PCN services. CPT code 99490 is used when your team provides a minimum of 20 minutes of CMS-approved care coordination services for your approved patients with 2 or more chronic conditions. CPT code 99439 is used when your team provides an additional 20 minutes of approved care coordination services for your patients. If you service Medicare beneficiaries with only one chronic condition, you have the option of enrolling these patients into Medicare's PCM program and receiving reimbursement under CPT codes 99487 and 99489. Knowing how to meet Medicare's care coordination requirements is critical to a successful chronic care management program. As discussed previously, implementing an effective chronic care management program that meets CMS guidelines and improves patient outcomes can be a challenge. So how can you do this without breaking the bank? My colleague Raj will fill you in. Take it away, Raj.
Thank you, Lil. You are correct. Starting a chronic care management program can be a challenge. In my experience, some providers will assign the task of setting up a chronic care management program to a member of their team, not understanding the specialized skills that are required to develop, implement, and manage a Medicare-compliant program. Or some providers recognize the challenges and never get started. A successful care management program requires exceptional care coordination skills, well-thought-out patient engagement programs, and knowledge of Medicare's chronic care management guidelines. Some providers outsource their CCM programs to tech companies that are able to provide the technology, but have minimal to no experience on how to provide quality patient engagement. At Chronic Care Advantage, we are looking to upset the industry. Our team has developed, implemented, and managed award-winning chronic disease education programs at the local and government levels. Our team boasts RNs with compact licenses, with over a decade of case management and care coordination experience. We are experts at chronic disease patient education and have over a decade of telehealth technology experience. To partner with such a team would cost thousands. But with Medicare's Chronic Care Management Program, you can partner with our Chronic Care Advantage team to operate your chronic care management program at no cost to you. We understand that as medical practitioners, The patients you serve are more complex and your time is limited. With homelessness on the rise and the increase in patient public health and advocacy needs, meeting the requirements for Medicare's value-based reimbursement will become more difficult. But it doesn't have to be. A successful chronic care management program will be a must-have in the very near future to meet these demands. Chronic Care Advantage can turn the challenge of improving patient outcomes, providing top-notch care coordination, and meeting the challenges of the changing healthcare landscape into a simple process. We plan to work with a limited number of providers to deliver exceptional care management services. Claim your free access to Chronic Care Advantage and valuable care management services for your practice right now. Don't miss out. Take action today by visiting at www.chroniccareadvantage.com and filling out our quick reach-out form. Act now, and one of our expert team members will be in touch with you ASAP.